Is oral cares. So you will begin by checking the patient's chart and ensuring that it is time for their oral cares. Then you'll enter the patient's room and introduce yourself, explain to them what you're going to be doing, and then you will wash your hands, apply PPE, gather all your equipment up, make sure your section is on and hooked up, and you'll have to probably remove it from the inline section and assemble your first package, which is your yonker. And then you will turn it on, pull the sheet back, and suction all through the patient's mouth, getting as far back as is comfortable for the patient. And then you will on to your next step, which is the swab. You will touch your swab, open your debriding agent, dip it in there, and then you'll swab inside the mouth, periodically turning on your suction and making sure that you get down in between their lips and their teeth on all sides, on the roof of their mouth, and on their tongue really well. And then you will throw that away and hook back into your inline section. And you will get your moisturizer and moisturize and get moisturizer on all sides of the swab. Moisturize all through the patient's mouth, making note of that ET tube when you go to do the lips. Make sure that you're not moving the ET tube, and just making sure you're getting the lips really good. And then you will come back 2 hours later, and you will start with another section with your yonker. Section for the patient's mouth. And then you will get the oral debriding agent that you use at your facility for your toothbrush. And you will dip it in, ours is a little brown cup, you'll dip it in that. And then you'll scrub the patient's teeth really well, making sure you get those bottom teeth under the lip and on the top as much as you can. Again, making sure that you don't pull on that ET tube. Also get along the roof of the mouth, right along the ET tube and the tongue, and periodically turning on the suction during this time. And then once that's done, you'll go ahead and suction again. And remove your yonker and plug back into the inline section. And you will take your moisturizer and you will get moisturizer on the sides of the swab, and then moisturize through the patient's mouth, on the roof of the mouth, on the tongue, and again on the lips, making sure you don't pull that ET tube. And then 2 hours later, you will come back and you will use your yonker and suction, and then you will attach your catheter, trying to keep the tip of the catheter clean. And turn your suction on and suction the back of the throat, and then go down into the trachea until you feel a resistance from that cuff, and suction all around the cuff, and then pull the catheter out and throw it away. And then suction again. And then if you have an extra swab package, pull your swab back, open another swab package, dip it in the debriding agent, and then you'll want to clean with your suction on, just in case maybe there were some thick secretions you pulled up that didn't get sucked out with the catheter. And then when you want to plug back into the inline section, and then you can moisturize again with your moisturizer on all sides of the swab, and then all through the patient's mouth, and again on their lips, making sure you don't pull the ET tube. And then you will make sure the patient is in their same comfortable position, head of bed 30 degrees, Make sure you can't hear any thick secretions, that they're gurgling, and make note of any breath sounds. Then you'll want to remove your PPE and wash your hands, and then chart the oral care in the patient's chart. Thanks.